Good afternoon, everyone. Wearing a tie, DeWine's College, home of the Yellow Jackets. Good wishes to all the DeWine's College grads out there. Let me start with the hydrochloroquine issue. This morning I issued a statement asking the State Pharmacy Board to pull back its order, basically banning hydrochloroquine for use in regard to COVID patients. State Pharmacy Board has now reversed that decision, and that was the right thing to do. I believe that their process in arriving at this original decision was fundamentally flawed. While, to my knowledge, they followed the law, it really did not provide enough opportunity for people to comment. And what they should have done, I believe, is had a full hearing on this, full opportunity, and really sought out additional medical advice in regard to this. So we're asking the State Pharmacy Board and the State Medical Board to examine this issue. We have seen throughout this pandemic that the ability to treat COVID-19 has changed. Doctors continue to learn more. And so one would expect that treatments will continue to evolve. And let me make this very clear. As Governor of Ohio, I do not have a position in regard to the use of this particular drug for COVID patients. That's not the job of the governor. That is not my job. We should leave that up to science. We should leave this up to the experts. I expect the medical board and the pharmacy board to thoroughly now examine the issue. I think it is interesting that this morning Dr. Stephen Hahn, Commissioner of the Food and Drug Administration, said on the Today Show the decision about prescribing this drug to treat COVID-19 should be between a doctor and a patient. So again, I'm not taking a position on that. It's certainly beyond my expertise, but I think this needs to be looked at more carefully, and the decision needs to be pulled back, which it was. Let's turn to today's data. Today, unfortunately, 1,733 new cases in Ohio. Shocking number. The 10 highest daily new cases reported, 10 highest daily cases, 9 have been in the past 3 weeks. Today's new case report is the highest daily count we've reported. So that is certainly not good news. If you look at ICU admissions, these are up a little bit above the 21-day average. Hospitalizations are up as well, and the deaths are running about the same as the last 21-day average. So let's look at the next one, Eric. Number of confirmed COVID-19 patients that are currently in Ohio hospitals. In other words, the number who are there as of yesterday remains a very high number. As you recall, we said that Tuesday we had the highest number of people in the hospital that we've ever had from COVID. So those are not good trends. We do, however, and we don't have a slide to show, but we do, however, continue the trend of seeing fewer people coming in to the emergency rooms who are complaining of COVID-19. So that is a good sign. Now, let's go to the new map and take a look at what it is. So we have good news and bad news. What we're seeing is fewer red counties, and we'll talk a little bit about that, and that certainly is very, very good news. What we're seeing, and we'll get into the details in a moment, but the urban counties that have had the mask orders the longest are seeing a significant decrease in where that line was going. And so they're still at a high rate, but that rate increase has certainly been dramatically slowed down. And that has occurred at a time when the mask order has been on for a significant period of time, and when the compliance from people, just anecdotally by looking as you go around, and as reported to me by mayors and others, that compliance rate has gone up significantly. And that is no accident that those two things are occurring together. The bad news. The bad news is that we have a lot more orange counties and a lot fewer yellow counties. And so what this means is that it's spreading out, and candidly in the rural parts of Ohio, the mask wearing is much less than it is in the urban areas. And that is one of the reasons that you're seeing the spread, and that spread will continue. As Dr. Birx told me this last weekend, Dr. Birx from the White House, Trump administration, told me, she said, look, if this will not slow down unless something slows it down, and mask wearing will slow it down. So that's the bad news. I'm going to go back and have Eric, if you could show going back to the first map we had. Again, you kind of get a picture, a lot of the yellow counties. A lot of the yellow counties, fewer of the reds. All right, let's go to the next one, Eric, on July 9th. Again, you'll see a little change there, a few more red, and a few more orange. Then the next one, Eric. Again, the red is filling out. Again, more, seeing some more orange. Let's go to the next one. July 23rd. And let's go from 23rd to the present then. So you can see the change. Again, some good news and bad news. Bad news is it's spreading throughout the state of Ohio, and we've got to slow it down in the rural areas. The good news is we're making some progress in the urban areas. So let me just go through this. We have 13 red counties this week, which is 10 fewer counties that are red than last week. So that's very good news. Let's look at Allen County. Allen County last week was on the watch list. It's hitting fewer indicators than in previous weeks. However, the cases have continued to increase in Allen County, although the increase is not as rapid. Increase over in Allen County, the increase is not as rapid as it has been in the past. Things are moving in a better direction. Residents of Allen County, we just urge you to continue to work to mitigate the spread of the virus. Of the 13 red counties this week, 8 of them remain in red status simply due to the meeting of the CDC's definition of a high incidence of the coronavirus, which, as you'll recall, is more than 100 cases per 100,000 residents over a 2-week period. Let's look at the counties of Allen, Cuyahoga, Erie, Fairfield, Franklin, Hamilton, Licking, and Lucas. These are the counties, as I said. These are the counties that are there because of a high incident number. So what it means is the rate of increase may be slowing down, not as many indicators, but they're over that level. Some of these counties are seeing cases decrease, others are increasing, but all remain at the level where the CDC considers spread of the virus to be high. For example, Franklin County still has 184 cases per 100,000 over the last 2 weeks, well over the CDC's high incident threshold. These numbers have improved. They're going down, but they're still high. We have fewer red counties this week. This week we have also, as I said, have our fewest number of yellow counties. When the system was launched, 54 of our 88 counties were yellow, the lowest level of spread. Today we only have 23 yellow counties, less than half of that original number, so they are moving up. Only 12% of Ohioans today live in a yellow county, 12%, while 44% live in red counties, and another 44% live in orange counties. Again, good news and bad news. Allen County, briefly, those numbers are up, but there is some good news there. Allen County dropped from the watch list this week. Earlier in the month, Allen County had several outbreaks that drove their numbers higher. However, what they're seeing now is an elevated level of cases that are being driven mainly in Allen County by family gatherings and community spread. Cuyahoga County. Cuyahoga County, the good news is that the number of cases per 100,000 is down. Red, though, for the 5th week. They haven't had large outbreaks, but many of their cases are tied to smaller events in Cuyahoga County: graduations, birthdays, card parties, etc. The health department there has received more than 4,000 complaints about staff and patrons not wearing masks in area businesses. Although, again, as you observe in Cuyahoga County, I think the incidence of wearing is going up, which is a good thing. Erie County remains high because of the number of cases per 100,000. And just to give you an idea, Cuyahoga County, as I said, is 139. Erie County is 126, which is kind of a shocking number. Erie County has had some outbreaks related to health care and agricultural settings. County residents also have been affected by outbreaks in neighboring communities. Fairfield County. Fairfield County is down a little bit. That's good. They're at 151 cases, though, per 100,000. That's still a very high number. They've had outbreaks connected to backyard parties. There also was a wedding 2 weeks ago that they're investigating that has several confirmed cases. Franklin County. Franklin County is down. Again, good news. 184 cases per 100,000 residents in the past 2 weeks, which is still a very, very high rate. They've had outbreaks connected to a behavioral health center, assisted living facilities, and restaurants and bars. Hamilton County at 114 cases per 100,000. They are again down, which is good news. Outbreaks in Hamilton County are linked to youth sports, workplaces, and long-term care facilities. Licking County. Licking County is up. Licking County is up. Red because of high incidence. Licking County has had an outbreak at a long-term care center, and local health department officials are investigating a potential outbreak at a religious center. Lucas County. Lucas County is up and showing very high numbers. Not good news out of Lucas. Outbreaks at Lucas County involve multiple restaurants, an assisted living facility, and a daycare center. They are at 183 cases per 100,000, so that's a high number. Now, let's look at 5 counties stayed red this week because they met 4 more indicators. Those are Henry, Lawrence, Marion, Medina, and Montgomery, which means they are for those reasons. Let's talk about Henry County. We told you last week about a winery in Henry County that had an outbreak from a Name That Tune event. Let me give you an update on that. On July 11th, the winery hosted the event. There were about 75 to 80 people who attended. However, to date, 90 people, this is just sad, 90 people have contracted the disease. All those people obviously were not at the winery. But that's how this spreads. What are we seeing now? What we're now seeing is what we call secondary spread. People who are infected with the virus from the initial event carried on to other people in the community. That can be a spouse, it can be a grandparent, a child, colleague, neighbor, or even a total stranger. Then those people also tested positive for the virus. But they all have a connection to someone who tested positive at the winery. Another important thing to note is this event is far-reaching. Already cases have been traced to 5 surrounding counties, and health department officials think there may even be more. Look, the purpose is not to pick on the folks at the winery or to say that, you know, what was going on there it was necessarily bad. The point is that in casual events when we're having fun, this thing can spread, and we just have to be very, very careful. Lawrence County, clear down the southern part of the state, met 4 indicators, including sustained increase in new cases and in outpatient visits for coronavirus-like illness. Again, an early indicator. County moving in the wrong direction. Lawrence County has had several outbreaks that are connected to funerals, a church camp, a restaurant, and long-term care. Marion County met 5 indicators, including a sustained increase in new cases and also a sustained increase in emergency department visits. Again, an early indicator. So while in the state as a whole those visits are going down, Marion this last 2 weeks has gone up. The county has also had outbreaks at long-term care facilities during the past reporting period. Medina, they met 4 indicators, including new cases per capita. Many of their cases were not in a congregate setting, indicating that the county has community spread. 1 outbreak is linked to a long-term care facility. Montgomery County, they're at 147 cases per 100,000 residents. They met 5 indicators this week, and they meet the CDC's threshold for high incidence of coronaviruses at 147. Let me talk about 2 different situations in Montgomery County. In one instance, 1 person passed it to 6 family members, including parents, a sibling, in-laws, and a child. 4 of the 6 were hospitalized, and tragically, 1 died. In another instance, there's an 18-year-old who's taking care of her 2 younger siblings while their mother is hospitalized with coronavirus. Look, this virus is just vicious. It does not care who you are. We tell these stories not to embarrass anyone and not to really disclose the information, but rather to use these cases to illustrate that it can happen to anybody. And it can happen when you're least aware that it might happen. And it can happen when you're with friends. It can happen with your family. Let me talk about a couple other stories. Tuscarawas County, a healthcare worker who works in Columbus went on a day-long canoe trip, something I love to do with our kids. They went on a day-long canoe trip with friends on July 14th. They all traveled in a van together, and then they developed symptoms. 11 people are on the trip. 9 of them are sick and have tested positive. The cases span 3 separate counties. Mercer County, on July 10th and 11th, a funeral, and then a charitable benefit was held where people attended from multiple counties. There are now 51 people, confirmed cases, 51. News, though, is not completely bad. We also talked to several of our counties that, as we've said, have dropped from red to orange. Here's a snapshot of what they've told us. And so a lot of people doing some great work out there. In Union and Clark counties, they're seeing better mask compliance. Businesses are working hard to follow health department protocols. Delaware County health officials couldn't pinpoint a specific reason, but said that their residents seemed to be wearing masks more than they were. And we're thankful for that. Defiance County had various hot spots during the past few weeks, but their health department said their community was quick to tamper those hot spots. Contact tracing and residents following quarantine requests has helped. They also said the community partners paused on activities, stopped activities and events to help slow the spread. So again, shout out to Defiance County and Delaware County and the other counties. Look, it is good. We can control this. We can get on top of this, and these are just some examples of doing that. We continue to have concerns about our bars. We've seen outbreaks associated with bars across Ohio, including Toledo, Cleveland, and Columbus. Let me just say to our bar owners, most of you are doing a phenomenal job. You're following the directions. You're doing everything you can to keep your bar open. Sadly, not every bar is doing that. Just last week, our Ohio investigative unit found bars where no social distancing safety measures were in place. The patrons were packed on outside patio, and a dance floor was full of people shoulder to shoulder. But actors like this, as I said, are in fact outliers. There is, however, kind of an inherent problem connected with bars. They do lend themselves to people going in and out in close contact with each other many times indoors. Patrons either stay at one location, sometimes for a long time, or they go from bar to bar. Either way, they're interacting with a lot of different people, and this is especially true with our younger crowd. And these, unfortunately, while may have been very benign and just fine in normal times, that these are not normal times. These are different times. We know of a case where a young woman in her 20s joined some college friends for a night out at a few campus bars over a weekend early this month. She then went home about 2.5 hours away. She then later started feeling sick. She learned her friends had tested positive, then she did too. Her parents got sick. Her brother got sick, so did her grandmother. Now, thankfully, the whole family quarantined, which prevented the virus from spreading even further. Look, we do not want to shut down Ohio bars and restaurants. That would be devastating to them. But we do have to take some action, and we'll see what kind of results we get from this action. So today, I'm announcing that I have requested the Ohio Liquor Control Commission to call an emergency meeting to consider enacting a statewide emergency rule related to liquor sales. This rule would prevent the sale of alcohol at all liquor permitted establishments beginning at 10 p.m. each night, with consumption of alcohol that would have been placed on the table must be completed by 11. So basically, if someone goes out for dinner at 9:30, they order, they get their alcohol, they get a bottle of wine, they could sit there and consume that until 11. So we want to shut this off at 10, but we also want to allow for people who are having a late dinner to be able to do that, and for the businesses to be able to accommodate them. So the businesses can stay open. We believe stopping the sales at 10 o'clock is going to help. We think it will help. It will help thin that crowd out and help slow the spread. This proposed emergency rule does include everybody who serves alcohol. Our proposal will also allow, we would continue the practice that's been in rule of allowing restaurants, if you go to get a carry-out meal, you know, you've been able to get 2 drinks associated with that meal, and in a carry-out situation, not for consumption there, but a carry-out. And so that will be expanded to 3. So people will be able to go carry out, get their drinks, and go home. Liquor Control Commission, I'm told, will hold their emergency meeting tomorrow at 9 a.m. If the emergency statewide administrative rule is approved, I intend to sign an order that would make it effective Friday night, this coming Friday, tomorrow. Look, and I'm mindful of the economic impacts that this has, but we have to slow the spread of virus, and we have to slow it down across the state of Ohio. We are reissuing in a different form our order in regard to mass gatherings. Our order from the beginning, from when we put these orders on, has been limiting mass gatherings to 10 people. Now, there are exceptions. There are significant exceptions, and that allows a lot of different activity. Those will not change. People will still be allowed to have people in their home. We're not regulating that at all. But we wanted to put these in one place so that anybody could go to the internet and look at them. And the reason we're doing this, to make it simpler, and not only to have what the orders say, but also what the recommendations are. Again, they're recommendations, but these are recommendations that the health department, in consultation with your local health department, has distilled down. And again, as you saw by the examples that I talked about, it's the informal, It's being with friends. It's the things we all love to do. It's being with friends, being with family, in backyard barbecues and all kinds of other things that we're seeing a significant amount of spread. And so we're not changing the orders. We're putting the orders in one place. Ohio does remain, though, at 10-person. A 10-person order. We have never deviated from that. Let me read the recommendations, because these are new. They're certainly new in one place, and we would just ask everyone to take a look at them. Go online. They'll be up tomorrow. We recommend the following related to gatherings. 1, gatherings at a household or family residence should be limited to close friends and family, and are recommended to be 10 visitors or less. Again, a recommendation, but again, we have found a lot of cases coming out directly out of such gatherings. For residents in a red or purple county, we don't have any purple, but for those in red, they should limit hosting or attending gatherings of any size. Again, should limit hosting or attending gatherings of any size. 3, we recommend that everyone wear a mask at all times at gatherings. Again, what happens is that we all feel safe. We're around friends. We don't wear a mask. So a recommendation is wear a mask at all gatherings and at all times maintain physical distance. So try to do both. In regard to the use of takeout, outdoor dining or indoor dining, should only do that when strict social distancing can be maintained. And so the restaurants are working very hard to make sure they do that. Next, take extra precautions if you go to bars or nightclubs, where use of masks typically is inconsistent, and as we all know, drinking alcohol can lead to less social distancing. So, again, we just ask people to be careful. Next, protect anyone with serious medical conditions at your home by social distancing at home, by wearing a mask at home, and using a high level of personal hygiene. So if you've got a grandmother who lives at the home and 20-year-old grandson goes out, if you go back in that home with grandmother, we just remind you, even though you're in your own home, the safest thing to do for grandmother is for you to wear a mask and to keep the social distancing. Next, high-risk individuals should take extra precautions to limit the number of people they interact with. So it's basic, but we wanted to put it in one place. Next, make the group of people you interact with most often as small as possible. Dr. Acton used to talk about your grouping, what do you call it, your tribe or whatever you call it, but it's your grouping of people that you interact with. Try to keep that as small group as possible. And then when you're interacting with anyone outside that, be particularly careful. So those, that will be up, and it will be, again, the new order, but it will be the same substance. But again, it's all in one place with these very, very strong recommendations. We'll open up for questions.
Jack Windsor, WMFD-TV, Mansfield. Governor, last week we discussed your Red Cross estimate that no less than 250,000 Ohioans have already had COVID-19. I raised the question about our original goal to flatten the curve and preserve hospital capacity, but you said that the new goal now is to keep people from getting sick, even those who don't know they're sick. NPR just released an article with 4 top epidemiologists from Johns Hopkins, University of Minnesota, and Harvard, all confirming what we discussed last week, that test, trace, quarantine, and mask policies will not work. Michael Osterholm, director of the Center of Infectious Disease Research at the University of Minnesota, said the following, quote, "When you have something like this happening, there's no way that traditional testing and tracing is going to have any meaningful impact. I liken it to trying to plant your petunias in the middle of a Category 5 hurricane." Based on this expert analysis, do you have a game plan to pivot from the failed strategy of testing, tracing, partial shutdowns, and mandates? And when will we shift from preventing cases to supporting health?
Jack, first of all, our goal has always been to save lives. That is the essential goal of what we've been doing. So that's number one, and that would come under, our hospitals not being overridden with people, and have people not get the treatment they want. But it also includes, getting as fewer people sick as possible. I'm happy to look at the NPR story. I will look at that and see what they have to say. The ways that you have outlined that you believe are failed and will not work are the only ways, frankly, that the vast majority of the medical community has come up with to intervene to slow this, short of a vaccine. And I would also mention, third, that we showed that this method of separation, of keeping distance, would work when Ohioans did, in fact, flatten the curve. And the only reason that we were able to do that and show those results is not just because that's what happened. We did it because Ohioans did what they needed to do, as Ohioans always do when challenged. And so they did that. We saw the curve flatten. It would not have been flattened. It would have gone up like that. So the methods of intersecting this virus from one person to another, either with the mask, with distancing, other ways, and then if someone does get infected, tracing that down and trying to make sure that that person does not infect others, or finding out who they've already infected and making sure they don't infect others, is an age-old way, going back hundreds of years to intersect that. So until the great medical scientists of this country come up with something else, that's what we're going to have to do. That's the blocking, that's the tackling, we got to gut this out. And there's no magic bullet out there, there's no magic wand that we can wave to do it any other way besides just fight this thing every day. And we've seen success. We saw success. We saw some success beginning in our urban areas because more and more people are cutting that virus off because they're wearing masks. Thanks.
Game plan other than, there's no game plan other than what we're doing now. So there's that or a vaccine. So there's no drug of efficacy treatment
plan that every expert that I can find to talk to, or every expert that is around in the world, thinks that we can do. If we have any other ways of doing it, I'd love to hear it, and we will deploy anything, that would slow this down. But what we're doing is following the best experts, and we're going to continue to do that.
Good afternoon, Governor DeWine. This is Laura Hancock from Cleveland.com. You've provided a lot of compelling examples of how coronavirus has spread through informal gatherings and events. Contact tracing has been going on for some months now. Why can't we get the data, not like specific people or their names, but like the data for, what percentage of this is originating in bars, what percentage of this is originating in daycares, other places like that?
Laura, we continue to try to get the best data. When we started this, we had virtually no data. The contact tracing, I'm as anxious to get this information as you are, maybe even more so, because we use this information to, frankly, make decisions and to inform the public. So we will make as much information available as we can. The challenge is you have 113 health departments that are doing tracing, and we're trying to get a better way to compile all that data as it comes in. But I would love nothing more than for you to be able to do what the news media does best. They do a lot of good things, but one is to tell the stories. Just tell the stories, because I think the more these stories are told, the more people will understand this is how people are getting infected. So I'll come back. I'll come back next week on Tuesday, and I'll give you a report about where we are, because I've been telling our team, you know, we got to dig, we got to dig, we got to dig, and we got to get this data better coming in. It's coming in from 113 health departments. They're the ones who are doing the tracing. But I will report back to you on Tuesday.
Good afternoon, Governor DeWine. Ori Givens with Spectrum News 1. I have a question about the PUA unemployment program. We have tens of thousands of Ohioans who have had their benefits frozen because of a nationwide fraud issue. What do you have to say to those Ohioans who continue to have issues with specifically this unemployment program, another thing keeping them from their benefits that they really had just got this past month?
The federal law requires, us to verify anybody who gets unemployment. So one of the kind of challenging things has been, as you know, besides the tremendous number of people who have been applying for unemployment, it's not just they apply and we give it to them. We can't legally do that. We have to make sure that they do in fact qualify for that. So I'm not aware of you know, the national stopping that. What does stop it is when we are looking at a particular case, and if the people who are charged by law with doing this, if they have a particular question or particular information and stuff that they've got to run down, then that has to be run down. But that's been the law, and that remains the law.
Help them get through to get this benefits established, this process.
What we say is, look, we have a lot of people who are working on these. It's a case-by-case. What I want to point out is it's a case-by-case situation. And look, I understand, you know, how tough this could be, but we have to follow the law. That's an excellent question. You know, we have, because of the differences in Ohio schools, over 600 and some school districts in Ohio. You know, we gave them some guidance on how to run the school during a COVID-19 pandemic as safely as possible, and so they've got a guidebook to do that. But we have allowed those schools to make their own individual community decision, which should be a decision with the parents. It should be the public, the school board, the superintendent. Some schools, as you have seen, have made the decision to go virtual. Some other schools have made the decision to give parents the option. You can do, and the families, the option. You can do virtual, or you can do in person. Others have split it in different ways. I know that some schools, Franklin County, for example, you know, the county health department has made a recommendation, and the schools are looking at that recommendation. Franklin County recommendation to go virtual. These are tough decisions, and there's no easy answers to them. We don't know where this virus is going to be in a month or 3 weeks when school starts back in. What we are trying to do is to continue to fight every day, to do everything that we can to take these numbers down. And I truly believe that what we do in the next several weeks will determine what school looks like in the fall. Schools want to have some certainty, parents want to have some certainty, and so schools are starting, understandably, to make these decisions now. But it's possible that this decision will be taken away from us basically by the virus itself. And so these are tough decisions. I have not put my thumb on the scale, so to speak. I've not at this point said, look, everybody should go virtual, everybody should go in person, because these are very difficult decisions for schools to make. We know what the Pediatric Association, you know, the doctors, pediatricians, what they recommended. They recommended kids go to school because there are in person, physically, because there are things that occur with kids and disadvantages for kids when they don't go to school. And we all can come up with our own list of those things. And so the ability to go to school and learn like our kids have always learned is also very, very important. So schools are weighing these two things. They're weighing the safety of not just the kids, they're weighing the safety of the teachers and the superintendents. So, so far, at least, these are decisions that we are allowing the local community to make, and it doesn't mean they're easy decisions. They're very, very difficult decisions.
Hi, Governor. Andrew Welsh-Huggins with the Associated Press. Governor, why shouldn't you have a position on not prescribing hydroxychloroquine for COVID-19? There are those who have strong positions that mask wearing can't stop the spread of the coronavirus, but you've taken an equally strong position that it does and ordered a statewide mask mandate. There's strong evidence disproving hydroxychloroquine as a treatment, including from the FDA. So what's left to examine on that?
Well, Andrew, I'm not, first of all, I'm not a doctor. I'm not a scientist. I'm the governor. And I believe that these are decisions that should be made by the state medical board and the state pharmacy board. But what I saw in regard to the pharmacy board's decision, and these are all volunteers, these are all people who are good people, but it did not allow for enough input from the public. I mean, they checked the box, they did the, they had the comment period, but for most Ohioans did not even know that period was going on. So once I found out about this yesterday, I started calling around and talking to some of our hospitals. And while it is not being used very much in Ohio for COVID, it does not appear to be, it is being used. You have the head of the FDA this morning saying it should be between a doctor and a patient. I don't have a problem with our two regulatory boards when they have something that they determine the evidence is clear that a drug is harmful or that a drug just is not working. I don't have a problem with them issuing those regulations. But what we did not see in this process was a complete and thorough examination of the facts. And so when I asked them to pull this back, I did not tell them what the right answer should be. What I said is you should go about the business of hearing all the evidence, weighing the evidence, getting input, and you make that decision. That's what these boards are to do, is to make that decision. There's no comparison, in my opinion, between masks, where there is virtually no minority view among professionals anymore. It's evolved, but there's no credible minority view on masks today. We have seen, just by looking at stories that have been written, you have seen some studies that have been done. I'm not going to stand here and defend this drug because I don't know enough to defend it, and I don't intend to do that. But there certainly is enough information out there that would indicate that when used possibly with other drugs, it may have value. That's not my call. So, in summary, I want our regulators in Ohio to do what they should do, which is seek the truth, get the information, make a medical decision, and we'll move forward. And whatever that decision is, that decision is. There's a fundamental difference between when it's overwhelming evidence in regard to the mask and in a case where it is a question of what a doctor should prescribe to an individual patient. I think when you get in the way between a doctor and an individual patient, there needs to be a pretty darn good reason to do that. That doesn't mean you shouldn't do it. That doesn't mean that regulatory agencies shouldn't do it. But there's got to be a reason to do it. I just want the process to work. I didn't think the process had worked.
Good afternoon, Governor. Jeff Reddick from ABC 6 News in Columbus. You may have seen by now that President Trump has floated the idea of delaying the national elections coming up later this year. You, of course, are one of the elected executives who has experienced delaying an election. Do you believe, at least in Ohio, that a safe and secure election can be held on time? Would you entertain the idea of delaying it in November?
No, the election should take place. Look, you know, we have a great experience in absentee voting. We have open absentee voting. You don't have to give a reason you want an absentee ballot. We've got it for a 4-week period of time. We've got the opportunity during that period of time for people to go to the Board of Elections on certain days and cast their ballot. And then you've got the 13 hours of Election Day. There's absolutely no reason to think that this election could not be held on that date. You know, this is not something that the president can do. You know, if there was going to be a change, it would have to be a change by Congress and states. But that's not, you know, that's not what we should strive for. I see no reason that would occur. It's hard for me to envision a situation other than a natural disaster that, you know, I don't know. We could all make up our own examples, but we've got 28 days, I think it's 28, to vote. You know, we have 4 weeks to vote. So I don't think we're having a problem. The election's going to be held, and you know, it's one thing about our system. You know, we hold elections, we accept the results. And even if we don't like the results, whatever it is, and we accept those results, and that's one of the things that makes our country great.
Thank you.
Good afternoon, Governor Noah Belinda with Hannah News Service. Congress is maybe starting to get close to another round of stimulus or COVID response. I'm wondering what you think are the top priorities for your administration and also for Ohioans that you really think should be a part of anything that comes out of Congress to address this situation.
Well, as I look at the months ahead, as we continue to fight this virus, having the money to do robust testing so that we never have to slow down is going to be very, very important. Testing is going to become more and more available. We've been able in Ohio, I think yesterday we were at 25,000. It wasn't too long ago we were at 8,000, then 12,000. So, you know, we've seen it go up dramatically, you know, but it needs to go up even more. And so we're going to continue to push testing out. We're going to do everything, obviously, to keep the price down. We're going to try to grow our own, in Ohio, our own capacity, and we're well on the way to be doing that. But ultimately, you're still going to need money. So testing, money for testing, money for tracing is going to be absolutely imperative, and flexibility. Flexibility for local governments, flexibility for the state in how the money is spent. So those would be my two. You know, we've also asked the administration to extend the federal authority for the National Guard. That's something the Guards under General Harris is doing a phenomenal job. So that's something that you know, Congress does not have to do, but we've asked the administration to do.
Thank you.
Hi, Governor. Andy Chow with Ohio Public Radio and Television State House News Bureau. Jumping off on an earlier question, when it comes to the president tweeting about mail-in voting and absentee voting, when he sends these types of tweets out, it kind of starts a conversation among people who might not really understand Ohio's process. What's your message to the people of Ohio who are now worried that the election system in Ohio can be rigged?
We have a system that depends on vigorous participation by the two main parties. from all the way down to the local level, to the precinct level, to the county board of election, to the local precincts, where there's people of both parties sitting there. Some have done it for many, many years. Ohioans know how to run elections. Frank LaRose will do just fine running this election. The local boards, Democrats and Republicans, will do a very responsible job in running elections. The absentee ballot part of that is well established in Ohio. It's not our first time to do it. We've done it for a number of years. Our additional voting on additional hours of voting that's available to go to the Board of Elections, we've done that for a number of years. So we know how to, Ohioans know how to run elections. And look, I mean, something can always go wrong. You can have something foul up. But by and large, we're not going to have a problem running this election. Yeah, I'm convinced it can't be rigged. I mean, look, we have to be vigilant. And there's nothing wrong with, you know, when people say be vigilant, yes, I agree. Take nothing for granted, accept nothing. Don't assume anything. But that vigilance, which is built into the system, and again, I think it's something that sometimes we don't really appreciate, but that Republican-Democrat vigilance, that one side's watching the other side, you know, is very, very important. And we've set up that system in this country, set up that system in Ohio, and it works exceedingly well.
Good afternoon, Governor. It's Laura Bischoff, Dayton Daily News. I'm told I'm last question. Today, Larry Householder was removed as the House Speaker, and a federal indictment was unsealed in the $60 million bribery scheme involving dark money from the utility company that got the giant bailout. When and how should Ohio repeal House Bill 6? And when and how should Ohio reform its laws regarding dark money?
These will be two issues that I will speak with the new Speaker and speak with the Senate President. And this both will be on our first meeting, and I hope that meeting occurs very, very soon. And we will both, all three of us will talk about that and look at that and look at the pathway. Both of those should be priorities. You know, John Husted, my Lieutenant Governor, had a bill when he was in the legislature. I know that bill has been reintroduced. We should certainly look at that bill. We've got to have our constitutional experts advise us about what is constitutional, what we can do and what we can't do. We don't want to pass a bill that's unconstitutional and gets thrown out. But these are two high priority items, and they will be in the first meeting when I meet with the two leaders.
Thank you.
Thanks, Laura. We have a message from famed race driver Dale Earnhardt Jr. Encourage everyone to take all the precautions that we talk about very, very seriously. So, Eric, let's take a look.
Ohio is open, but the fight against COVID-19 isn't finished. To continue supporting businesses, first responders, and each other, we must continue the safe practices that got us here. So please, wash your hands, keep your distance, wear a mask, and if everyone does their part, we can keep this great state open for good.
Well, thanks to Dale for that good message. We look forward to seeing you all 2 o'clock on Tuesday. Thank you very much.